Thank you all for attending this NeedyMeds webinar. My name is Elizabeth Messenger. I am the Director of Outreach and Education here at NeedyMeds. Today what we're going to be doing is talking about how you can find assistance with expensive medical bills with Medical Bill Mediation. We have Thad Puckett here, who's the Vice President of Technology of the Karis Group, an Austin, Texas professional services firm. He's worked at Caris since 2009, and he spent 16 years living in East Asia prior to working at Caris. So today he's going to talk about how the Karis Group can help you with your expensive medical bills, sort of go through the process and explain how you can find assistance. NeedyMeds is working with the Karis Group just to offer their resources to our NeedyMeds users, so we're excited to have him on today to give us some more information about it. Just a few housekeeping things before we do get started. Everyone will remain on listen-only mode for the duration of the presentation. If you do have any questions during the presentation or at any time, you can type them into your questions bar in your control panel, so you should see that there. And Thad will answer questions at the end of the webinar. So again, anytime you think of questions, you can go ahead and type them into your questions bar in your control panel, and we will have a Q&A at the end. This webinar is being recorded. It will be available on the NeedyMeds video page on our website as well as on our YouTube page. So you can also view it later if you want to share it with anyone. You'll also be able to contact me to get a copy of the slides if you'd like that as well. You should have all gotten an email with my contact information, and you will be getting another email. So you'll be able to get a copy of the slides, and again, the webinar will be recorded as well. So without further ado, I think I'm going to pass it along to Thad.
Who is the Karis Group? Karis is a professional services firm located in Austin, Texas. We've been around since 1996. We started when our founder, Dr. Tony Dale, who is a physician himself but born in Britain, moved to Austin, was unable to practice medicine, and had the great misfortune of tearing up a knee playing squash one afternoon, and the ensuing hospital bills that went with the surgery that he had as a result of his injury just kind of blew him away as to what the cost of the actual procedures were. He didn't have insurance at the time. This is back in the mid-90s. So I can only imagine how much less the procedures must have been in those days. But he called around to the providers after he had his bills in hand, and he was amazed to find out that the providers were actually willing to lower the cost on his surgery and the procedure. And after that event, it kind of birthed in his mind the idea of a company, and that company was the Karis Group. We're going to deal with the impact of what our company does. We're going to look at patient advocacy, or as we're terming it for our direct-to-consumer offering, it's called Medical Bill Mediation. We're going to differentiate just a little bit what the difference is, and then what can the consumers of medicalbillmediation.com, once you've come to our website, establish a case, then you can. We're going to help you understand what you can expect from the Karis Group and from Medical Bill Mediation. And then, as Elizabeth already indicated, there'll be some time for questions at the end, but there are a few frequently asked questions that almost always come up when we do presentations. So we'll jump ahead. I talked to you a moment ago about how Karis got started. We are located in the central part of Texas. We do contract with businesses, mostly insurance companies, wholesalers, aggregators, as well as employers nationwide, and they have group sizes from several hundred or 1,000 up to well over 100,000. Our services, in many instances, especially if it's through an employer group or through a benefit plan of some type, is through members who would have access to when they incur large self-pay balances. Now, I was talking with a colleague this morning. How do people understand self-pay? At the end of the day, a self-pay or out-of-pocket balance is whatever's left over after somebody else is done paying. So, for instance, if you go to a healthcare provider and it's your first visit there, they're going to hand you a form, and you're going to fill out information on that form: your name, your address, maybe a little bit of your medical history. Your doctor is going to want to know if you have insurance, and if you do, you're going to complete that piece of information with the policy number and the group number and those pieces of information. And then there'll be the last line, even under the insurance part, that is for your signature, under which says, I acknowledge knowledge that even if my insurance company doesn't pay all of this, I am responsible. It's that portion of the bill that some third party is not going to pay that you have to pay is what we will go to work on. That's the self-pay balance, the portion of a bill that's left over after anyone else who might be going to pay actually does pay. Last year, at the request of a large insurance firm whom we are contracted with, we actually opened our services directly to consumers via medicalbillmediation.com. We did that because that particular insurance firm had a major medical, obviously, book of business, a large book of business, but they were aware that some of their members would go to have services out of network. And obviously, when you go out of a network, an insurance company's network, you're incurring your own expense at that point because it is an out-of-network expense. And in many instances, those expenses would not have even been applicable toward any kind of deductible. So at the request of that insurance company, we did open our services directly to consumers. We titled it medicalbillmediation.com, and I'm going to explain in just a few minutes what mediation is. What we typically do, though, is we take what would be an impersonal benefit plan and we create something that is very personal by building a relationship and pursuing solutions that are customized based on that relationship, based on that knowledge that we develop about our member, the consumer of our services. We're going to develop an approach to dealing with how we can reduce those medical bills down. We do work for the member or for the consumer, mediating and advocating on their behalf to obtain the best resolution available for the self-pay portion of those medical bills. As I indicated, we do work each month for hundreds of members and on thousands of bills each month, typically over $2 million worth of bill volume. Last year we worked with over 3,000 members and over 10,000 bills, and we saved over $24 million last year in 2012. Patients with more than $1,000 worth of medical bills that are outstanding can open a case with the Karis Group via medicalbillmediation.com for a $200 charge. Now, the $1,000 of medical bills, now if any of you have ever had the great misfortune of an injury, you're going to know how quickly those medical bills can go way past $1,000. Let me give you a quick example. A few years ago, I decided I needed to exercise, and this is my story. So I mentioned a moment ago about Dr. Dale, when he founded the Karis Group, that he had injured his knee. Well, a few years ago, I was wanting to be a good steward of my body, and so I started exercising, and at the encouragement of my wife, I started walking, and then after a few weeks of walking, I decided I was going to play basketball. And so one night I went to play basketball with some guys in their 20s. Now, I was in my 40s at the time, probably not the brightest thing to do. But when I went and played basketball, I was playing the best basketball I had ever played until the third night out. And the third night out, we were almost done playing, and I went up to block a pass. When I came down, my knee buckled. I felt like I had done a Joe Theismann. I felt my knee to see if it was straight or if it was out crooked. It was, in fact, straight. And I thought it was going to be okay, but of course after they carried me off the court and I hobbled over to my car, or then to my car and went home, I went to see my physician. Now, that's one bill. I saw my family physician, and he indicated, wow, this is a problem. You may need to go see an orthopedist. So I went to see an orthopedic surgeon. He had set up the visit. I went to see the orthopedic surgeon. And I explained that my actual family doctor had actually withdrawn some bloody fluid off my knee, and the surgeon said, uh-oh. Now, I don't know what about you guys think, but whenever a physician says uh-oh related to something I've told them, that does not make me happy, doesn't make me feel confident about what my situation is. So I had so far had one doctor visit to the family physician. I had seen the orthopedist. He ordered an MRI. That's a third bill. And then he set up a surgery at an outpatient surgical center. That's a fifth bill. Of course, if you've ever had a surgery, you know there's going to be a lot of other people that are standing around or participating in your surgery, including the anesthesiologist. You have the radiologist who had to So my point is to say that it's really easy in today's world to blow past this $1,000 out-of-pocket medical situation without really trying. I don't know about your family, but if I get any kind of bill that comes to my house for over maybe even $30, $40, $50, I'm paying close attention. When it goes well past $1,000, I know I've got a problem. and I need help. And that's what medical bill mediation was created to do, was to help people who are left with significantly large medical bills, who are in need of assistance but don't necessarily know quite how to proceed. Well, what do? If you open a case at medicalbillmediation.com, assuming you have $1,000 of medical bills, you're going to be initially charged $200. But what we want to help you understand this afternoon is that most companies in the space that we occupy, that the Karis Group is in, would charge anywhere from 25% to 30% of total savings across all bills. So, for instance, in the situation I just mentioned, if you have a $1,000 bill and we save you $250, that's what it gets reduced to, then we're only going to charge a $200 charge, because that's 20% of what the savings would be. Now, that doesn't make much sense, did it? But it gets really significant when you start realizing that other companies have no maximum. So let's say instead of having $1,000 of bills, you have $10,000 of bills, or even worse, if you have $100,000 of bills. Other companies would charge you $25,000 or $30,000 if they were able to reduce that $100,000 bill or set of bills down to by any large portion. They're still going to charge you $25,000 to $30,000. Well, at the Karis Group, we're going to make an offer to you. We're going to charge you $200 to open a case. We're going to charge you no more than a maximum of $3,000, and that would only be 20% of savings, whatever the dollar amount would be. So it's either going to be 20% of the savings, but no more than a $3,000 charge to us. We believe that our services are so valuable to people that we're also going to make you a guarantee, because we believe that our services are things that we're capable of getting because they're based on real experience. We work with thousands of people every month, and our advocates are the best in the business. They do secure savings. They're going to craft an approach with a provider or set of providers, and if we don't meet or exceed your expectations with regard to what we're going to save you, we're going to return your money. So if we don't save you a penny, you've not lost anything. If we save you $60,000 off your bill, we're only going to charge you a grand total of no more than $3,000. We believe in our services, but we also understand that people need assistance, and so we're working towards the best possible solution for the individuals who are stuck with large out-of-pocket expenses. We do offer that guarantee. We're the only one in the business that would do that. Now, what does it mean to say what is medical bill mediation? What does it mean to mediate? Well, the truth is it really means just to get in the middle of and to negotiate. And in this instance, we're talking about the Karis Group advisors, your Karis patient advisor, or patient advocate rather, standing in your stead in conversation with your healthcare providers. You know, I mentioned about that surgery a few minutes ago. Any typical, it's not uncommon at all to have multiple bills that come out of a single injury or a single illness. We're going to relate to those bills as a single related medical incident, but we're going to deal with all of your providers for that single charge of $200 to open the case, and then up to whatever the dollar amounts are and whatever savings we get for you. But we're going to represent you, the consumer, before your providers. And you may say, well, that doesn't sound like it's that difficult. We could do that. And you know what? There's absolutely nothing untrue about that. You could actually do the work that we do. However, we believe that third parties who are not necessarily the individual themselves can typically get a better hearing from doctors and from hospitals who are willing to say, yeah, we'll talk to you, a third party, a business, about lowering that bill. And it might be a little easier than it would be for you to actually get that same kind of significant reduction or discount off of your existing bill. Now, I want you to understand with clarity, we're not talking about a preferred provider organization network. We don't have a network of providers that we've already contracted to discount bills. We're talking about crafting an individual approach based on as a consumer, your specific financial circumstance or situation. And then we're going to approach all of your providers on your behalf, trying to get those bills reduced, or in many instances, written off completely if possible. That's our highest goal, our best goal, our highest pursuit of what we do is when we are able to get the bill entirely written off. But remember, we do, as a third party, have to respect providers. Why is that? Well, the Karis Group, we do this every day. We talk to medical providers across the nation every day, all day. And our patient advocates are quite good at it, but they also know that next week or next month, they may likely talk to that same billing office at that same hospital. And if they offend them this week, trying to secure a cutthroat deal or something of that nature, they're going to have a real problem next week. So what we've learned in our 17 years of experience is how to act as a mediator in between you, the consumer, and the provider to help you get a better cost for your expense, but also for the provider to actually get paid. So that's what it means to do medical bill mediation. We also refer to it as patient advocacy. So if you hear me slip up this afternoon, just understand that I'm talking about patient advocacy and medical bill mediation in the same vein. Well, we do 6 things primarily. We mediate, we educate, because a lot of times patients don't understand all the options that they have. I know if I get a bill, and especially if it's been outstanding a little while and someone threatens to do something with that bill, like send it to collections, then I get a little agitated. And we've worked with enough patients through the years to understand that concern. We understand the need to help educate patients, consumers of medical services, about what their options are. But we also advocate on behalf of that patient, of you, the consumer, while respecting the healthcare providers. We're going to pursue all available financial assistance. That could well be charity care that's offered from the provider, but it also could be any kind of governmental assistance that may be available to you. Again, that's going to be crafted. Our approach will be crafted based on the financial situation that you, the consumer, are in right now. Not what you were in 2 or 3 years ago, but what you're in right now. We negotiate. We're going to work towards a discounted settlement if we can't get the bill entirely written off. And then finally, also towards payment plans. Now, I know that a payment plan sometimes can be for the full amount, but I also know that most people are really willing to make good on their bills if they're capable of doing so. A large portion of bankruptcies in the United States are because of medical debt. Well, we don't want anyone to have to go down that path, and if it's possible, it's never our preferred option, but if the best solution we can get is a payment plan, we found that patients can have expressed tremendous gratitude toward the Karis Group patient advocate when they were able to craft a payment plan that was a manageable amount on a monthly basis. So that's what we'll work towards. It's not our best goal necessarily with the payment plan because it indicates maybe there hasn't been any kind of significant reduction, but we do want to make the bill workable or livable for our patients. And then finally, we can communicate. We're going to communicate with patients as well as with providers to let you understand what the status of your case is, as well as what the current status of an individual bill may be at a given provider. So those are the things that we do, those 6 things. What can you as a consumer or a customer, what will your experience be? Well, we're going to assign to you, the consumer, the customer of medicalbillmediation.com, your own personal patient advocate who you will work with throughout the entire process. We just found that if you work with things like medical bills, it's too easy to feel impersonal in the whole situation, the whole circumstance of interacting with healthcare in general. But when we found out, we just discovered over 17 years of doing this, how much individuals value having a personal relationship with their patient advocate. So we don't use a queue system. So you'll have your own patient advocate. We, Karis, and Medical Bill Mediation staff will actually phone to the consumer once they've opened a case to obtain other pieces of information that will be necessary to craft our approach with healthcare providers. We'll verify that information, ask for any additional information that we may need. We'll also describe the service and what the approach will be and how long it can take. Typically a case, once it's open, can take anywhere from 30 to 60 days. We average about 50 days, but we say 30 to 60 days because sometimes, especially if you're trying to seek some kind of financial assistance from a hospital, they don't necessarily make those decisions every day of the week. It may have to go through a couple of meetings at the providers and maybe some kind of staff level. So it can take a little bit of time and a little bit longer. We'll also answer questions that the consumer may have about their medical bills and what the process is. And then finally, we're going to provide to each member, to each consumer or customer of medicalbillmediation.com, your patient advocate's email address, their phone number, their fax number, as well as their mailing address. Now, what can customers expect? What are we going to do at Caris? Well, we're going to take responsibility. We're going to stand in your stead as a mediator between you and the medical provider. And some people may say, well, yeah, can't we do that ourselves? Absolutely. The same way you can do your taxes yourself. Nothing's stopping you if you've got a really complicated income tax or set of records with your own in terms of your own income. Nothing's keeping you from actually doing your own taxes. I remember when I started many years ago doing my taxes, I was 16 years old, and I got I think it was 1040 EZ, and it was pretty simple. It was a one-page form back in the late 70s. It's not as simple to do your taxes these days. There's a reason that things like companies like TurboTax make so much money each year, because it's a very complicated process to do your income tax. Well, what we discovered as a third party that mediates on behalf of patients who've already incurred medical bills is that our expertise can be leveraged on your behalf. So we're going to take responsibility by mediating on your behalf with healthcare providers. But we're going to chase down all available options. We're going to chase down paperwork, whether it be from the provider. We're going to get paperwork back from you to give and send over to a provider. We're going to identify decision makers in this process at the healthcare providers that are needed. And then we're going to continue to do that till we work towards a resolution on behalf of your bills. We're going to communicate. We're going to communicate consistently to make sure that you, the consumer, is well aware of what the status is of your case and then what the timeline is on resolution for your particular case or your bills. But we'll also respond to emails, to voicemails, and then we're going to, at the end of it all, we're going to seek out from the consumer a patient satisfaction survey, because we take seriously the idea that we want the customer experience to be one that is valued, that is personal, that has impact, and we want to get the feedback from the consumer of our services so we can adjust as is necessary. But we'll also need the cooperation of those of you who actually pursue or sign up through medicalbillmediation.com, because a lot of times there are decisions that, while we can represent you to the provider, we have to know exactly what your desire would be. So for instance, we'll not commit you to something that you're not capable of paying. So if you had a $100,000 bill and the provider said they would take a $20,000 lump sum payment, we're not going to commit to that until we found out, can you, the consumer, actually afford that kind of payment? If you can't, then we're not helping anything. So we'll communicate, but we're going to actually need cooperation from each of the customers that sign up via medicalbillmediation.com. Now, our average savings is over 30% per bill. Our overall savings is more than 50% on total bill dollars. Now I'm going to explain a little bit about what that means. Let's say we have two bills. One is $100 and one is $10,000. We've got $10,100 worth of bills. Maybe on the $100 bill we get a 5% discount. So we've saved $5. But on the $10,000 bill, we get a $5,500 discount, or 55% discount. So the resulting average of that, the savings, would be 30% per bill. But the total dollar savings would be $5,505, which is actually more than 50%. So we do kind of work in two themes, with the overall savings being the one that is a little more important. What's the overall savings is greater than 50% on total bill dollars. We are successful in reducing 3 out of 4 bills, and as I indicated earlier, typical cases take between 30 to 60 days to complete. Now, again, I want to reiterate the guarantee. If we don't succeed in reducing your bills enough to save you any money at all, we'll refund your $200, and we'll never charge more than $3,000, which, you know, that would be $60,000 worth of bills. 20% of savings would be $3,000. We're never going past that maximum amount. We believe it can make a real difference for for consumers, and we believe that the service is of such nature, and we have had such success that we can offer this guarantee. These are some of the things the impact that our customers have indicated to us through the years. Some of these are obviously represented by large employer groups. Some of the enrollees at one employer group actually saved their employees over $4 million. But you can also see that a lot of people are expressing gratitude, because it's a significant burden to wonder where those bills are going to, how they're going to get managed or taken care of. And we can assist in that. We can bear that burden for you, and we believe you're going to find the service to be something that's of great value. What is a single related medical incident? Now we're in the frequently asked questions. Remember my example of the knee injury? Well, that would be a single incident, a single related medical incident that resulted in multiple bills. Most times these days, large bills are related to more than one, to a single incident, but they come from more than one location. And we're going to not treat those independently. We're going to treat them as a group and call it a single related medical incident. Out of pocket, how is that calculated? When all the bills from that single related medical incident are totaled together, and then if applicable, any network discounts or any payments from third parties, maybe an insurance company or maybe car insurance if it was an accident or something of that nature. Once everything's been paid and everything's been discounted, the amount that's left for you as the individual to pay, that's your out-of-pocket balance. That's what we'll work for or work on behalf of. Is there a threshold? There is, $1,000. If you don't have $1,000 worth of bills, we really believe that it's not going to, our services won't be of that great a benefit to you, and so we do have to have a minimum of $1,000 worth of bills that are related to the same medical incident. And are there exclusions? There are a few. Mental health or prescriptions or substance abuse. Now, in many of those instances, it's not that we're not interested, it's just simply that providers, like a pharmacy, you're not going to get out of the pharmacist office, or sorry, from the pharmacy without paying for your medicine. So once a bill has already been paid, it's usually very impossible to get money back. And then also with mental health and substance abuse centers, we just discovered in our 17 years that those providers are generally not willing to discount with anybody, much less a third party. And obviously then we only work for bills that, on behalf of bills that have been incurred at providers located in the United States. There are a few other things. When do we start working on a case? We're going to be working on it as soon as you get the case open. You're going to hear from us within 48 hours. Usually it's much faster. And we're going to get working on your behalf. There is a medical information release form that must come back to us from the consumer. That is the HIPAA compliant form that authorizes us to represent you with providers. A lot of phone calls that are made to your advocate may go to voicemail. Why is that? Well, the reason is your advocate's on the phone talking to other providers or to other patients. But we do train our staff to respond promptly to voicemails, and you can expect that if you do leave a voicemail, we'll hear back from your advocate in short order. How often do we contact those of you who open cases with medicalbillmediation.com? We'll talk to you at least every 10 days. We do believe that it's important to stay in touch, even if we're only waiting to hear back from a provider. We want you to know that the case is still open and that we're still working on your behalf, but we're just waiting for the next step from, in many instances, the medical provider. And our hours. Our hours are from 9 a.m. to 5 p.m. Central Time. We are officed in Austin, Texas, and are thus in the Central Time Zone. I do hope you'll ask questions, and I'll leave this slide up while we take any questions.
Okay, thank you so much, Thad. I think we do have some questions, so I'll just kind of start going through them, and please feel free to type in any questions at this point that you do have for Thad. We have some time for questions, so we will start going through those now. Okay, let's see. So first question, do you look for errors in bills, or do you just negotiate legitimate charges?
No, we do not look. I mean, in most instances, we have just discovered that providers work more readily if you're not calling out what their errors are. So we're not trying to identify overcharges or I mean, if they're egregious and they're obvious, then obviously we would. But typically, we just take the amount as if it is a bill that the charge was a valid charge, and then we work to negotiate. Again, from our perspective, we've had far more success and far greater discounts when we've not approached it by a line item kind of challenging a charge, but taking the overall bill dollar or bill charge and trying to reduce it to, based on the family's financial situation.
So is there any flexibility with the $200 upfront fee, or could you possibly just go over that again? I've gotten a couple questions about kind of how it works with taking the percentage out and what people need to be able to afford, right off the bat.
Yeah, what we've, obviously we're always concerned with, we want to be of help to people, but because we are a company that has to pay our bills too, we found that having the $200 charge up front, which we'll be charging to a credit card or a debit card, just helps us to get to people who will be capable of paying providers and even a discounted amount. So the charge of $200 is applicable towards whatever would be due to Caris at the end. So let's use a mythical figure of $10,000 for a bill, and let's say we get it 70% written off. So that means you're left with we saved you $7,000. Well, 20% of $7,000 would be $1,400. Because you've already paid us $200 to open the case, we're not going to charge you an additional $1,400. We're going to charge you a total of $1,400. So the next charge would be $1,200 against a credit card or debit card. Now, we are actually able to help you work out payment. That it would be via credit card and or debit card, and we'll work out how many months that can be paid. And we do have some flexibility with that regard, but it is 20% of the savings, and your $200 will go towards whatever that dollar amount is. And again, the guarantee being, if we don't save you an amount greater, if we don't save you any money, then we're obviously going to return your $200 to you.
Okay, great. There's a question about if someone starts working with you to reduce their bill, and then maybe they get enrolled in some sort of financial assistance program, maybe they get a grant or something, and they have covered their costs. What happens then?
Well, what we feel like is if we've done the work to help you get onto that financial assistance program, then we have earned the right.
Is that something you do?
Yeah. Oh, yes, absolutely. Because again, many patients are not aware of what all their options are, and it's not so much that healthcare providers don't make it difficult to understand. It just can be, a lot of times you're hit with. So let's say you have an emergency situation, you go in and you're admitted into hospital. You're going to sign whatever's necessary to get whatever service you need, but you don't always understand what may be your options. So if we help to qualify someone at a provider for financial assistance, then we believe that we've actually done the work that was what we were charged to do, what we were tasked to do.
Okay.
But we're not going to, that's not the only pursuit, because the truth is not every person is going to obviously be capable of or will qualify for financial assistance.
Do you work with just the management of hospitals or also with the financial counseling departments?
It can be with billing offices, obviously hospitals are very eager. They want to get paid. They want to have people who have perhaps been stuck with bills that they can't pay find ways to get some resolution. So it's not uncommon at all for us to develop working relationships for patients with the financial counseling office of specific providers. And again, that's going to vary by need and by specific situation.
Okay, great. So here's a question. If a bill has gone to collections, do you negotiate with the collections or the provider?
It can be either or. Sometimes hospital providers actually they call it internal collections. They'll say to the consumer it's going to collections, but it's in-house collections, and it's something that they can pull back. That can be like let's say the situation is you for whatever reason the patient has ignored the bill, has not paid it, and it's gone out maybe 90 days past the date of when the bill was incurred. It hasn't been sold per se to a collections agency at that point. It's still trying to be collected, and it's called in-house collections. But we do work with both actually, and if it's gone to collections, we'll identify which agency has that, and then we'll deal with collection agencies as well.
Great. We got lots of questions, so we'll keep going through them. You can also keep typing them in. We'll get through as many as we can. So I guess there's a question about kind of who you work with, people who have insurance, people who don't have insurance, a combination.
It's a combination. We have, in our, our wholesale business, which is sold to, it's called Karis Patient Advocacy Services. Those can be limited benefit medical plans. It can be some discounted medical plans. It can be life insurance companies that have rolled our benefit together in with their. We have employee assistance programs that we have have contracts with, but then the direct consumer is medicalbillmediation.com, and that's for people who have already incurred medical bills.
Okay. All right, let's see. Can you help someone with a very large deductible negotiate a lower cost, even if the insurance company hasn't paid anything toward the bill?
Sometimes, and I say it this way. Obviously, when you have insurance, you have a contracted amount, and you're a part of that contract as the insured. You have a contract with that provider because your insurance company has worked out that contract. It gets a little less clear when you, especially if it's an out of network situation, because there is no contract by default, or by default when you say you've gone out of network, there's no contract with that provider, and that would be 100% the insured's responsibility to pay. Those are circumstances where we absolutely can work on behalf of someone with their insurance, because there's no insurance money coming towards an out of network provider.
Okay. So I think there was a little bit of confusion with whether the service is available through companies or through individuals, and so I think the answer is both. And you've been mentioning you can go to medicalbillmediation.com for individuals, and companies can also contact you as well. Is that correct?
That's in fact, if there are representatives of employers, or any kind of benefit group, benefit plan, fraternal organizations, life insurers, anybody that has the opportunity to add a benefit together into another core product, we would love to talk to you, and our sales staff would happily talk to you about that. But then for individuals, on the slide that's on the screen right now, you'll see medicalbillmediation.com/NeedyMeds. That's the place to go if you're an individual, or you know of individuals who already have medical bills that they need some assistance with to try to get those bills reduced and resolved.
Yeah, and I did mention at the beginning that we've been working with the Karis Group. You may have noticed that section on our website, which has the information that we talked about today, and again, the same type of contact information. On our website, you'll see that it's actually our phone number, and our NeedyMeds call center representatives will actually screen the people and get them off to the Karis Group. So there are a lot of ways to get in touch, but you can go to our website, you can go to medicalbillmediation.com, either way. And you can also call that number, correct? For people who don't have access to the internet, if someone wants to refer their clients, they can call that 877?
That's correct. That's the medicalbillmediation.com toll-free number, and one of our staff will take your call and get you started.
Okay, great. Let's see. There's a question about the kind of experience that your advocates have. Do they have experience working with collections? What kind of people are doing that work?
Well, there's no one that has ever worked at a collections agency, but all of them worked, weekly with collections agencies. Rather, we have a varied staff. We have folk that have been in benefits, or worked in insurance, worked in hospitals. We have people who have bachelor's degrees in medical information technology, or not medical bill mediation. That's the title. Sorry, that started to come out. But healthcare management, and we also have former nurses on staff. These are people that understand what it's like to be within healthcare, but from the perspective of the consumer, and especially for an individual who don't have necessarily all the resources necessary to know how to navigate through the healthcare system. It can be pretty daunting in some instances. Our staff gets very excited when they're able to help anybody. It doesn't matter if they're saving them, if it's only $100 of savings. But I know a few weeks ago, one of our staff saved someone who had a limited insurance, and had incurred almost $500,000 of bills in an accident. Actually got over $400,000 worth of those bills written off completely, or 99.7% by the provider. And that advocate was just so pumped that entire week, because he was able to deliver a message to someone who really didn't know what they were going to do, a young person in their 20s, what they were going to be able to do to deal with those kind of huge medical costs, and then just to hear the relief on the other end of the phone. It's a very rewarding work for our staff, and they take it very seriously.
Okay, great. We had another question about helping people get onto like copay assistance programs and other things, and I believe you do that kind of work, looking for assistance programs that might be able to help them. We'll craft the approach based on what a family's financial situation is, and a lot of times providers are going to want to see, if you're applying towards financial assistance, they're going to say, well, what was last year's income? Well, the problem is, in the world we live in, last year someone may have been employed. This year they're not. Last year they may have not encountered other kind of, significant events. And what our advocates will do is tailor their approach based on the current financial situation of the family or the individual that they're working on behalf of, and then win a hearing in many instances with providers so that they can
can get the bill reduced or written off, which is their highest goal.
Great. I think there's a question going back to when you talked about a single related medical incident. So if someone has, if it's a cancer patient, they have several bills over time related to cancer, is that considered same event? How does that work?
That would be a single related medical incident, and that's a different. Sometimes, especially if you have an insurance if your understanding of how you're dealing with your bills is based on how insurance would deal with it, you might have a deductible that would have to be met annually, which might mean that if in the instance of a cancer patient, if they started in cancer treatments in 2011, they would have had a deductible for 2011, one for 2012, and again for 2013. But in our situation, we're not going to, we don't, that's a single incident with all the bills that would have flowed out as a result of that. So we would determine a cancer situation as a single related medical incident.
Okay, great. Well, I think that we will wrap it up at this point. So thank you so much, Thad. I don't know if you have any closing thoughts at all.
I really appreciate your time. We all live in a period of time when we think there are not many options for us if we have to have health care, and there really are. We found that providers are by and large people of very good will that want to help people deal with their medical expenses, and they want to treat people and care for people, especially doctors. Caris and Medical Bill Mediation.com, we believe, is a great alternative. We believe that we make health care work for everyone.
And here at NeedyMeds, we're always trying to share resources and programs like yours that can help people with their medications and healthcare costs. So please definitely stay tuned. We have our special topic webinars every few months. You can always check back to our webinar page for our next one coming up. And we have a regular NeedyMeds webinar coming up on Thursday, I believe. That will be an overview of our website, going over our resources if you want a review of NeedyMeds. One more time, you can email. You'll get an email from me with contact information, but you can email outreach@needymeds.org for a copy of the slides, and again, you will get an email with that information. A recording of this webinar will be available on our videos page as well as our YouTube page within the next few days, probably by the end of the week, so you can check back for that. And I really appreciate you all attending this webinar, and I hope you have a wonderful afternoon, so thank you very much.